You are most welcome in this session. So today I'll be discussing the interpretation of a prescription. As health workers, shall basically be interacting with the prescription that patients or the public or the the caretaker will be bringing to us, dispense the medication for the patient. So the objectives of the session will basically be to define what is a prescription, types of prescription, forms, parts, and part 2 of the video will have the interpretation of the abbreviation or the prescription itself. So what is a prescription? A prescription is just an order or instruction. This is written by an order. This just the prescription is an order or instruction written by a medical practitioner that authorizes a patient to be issued with or dispensed to the medication for the purpose of treating a particular disease. However, as we saw earlier, that the medication may not only be for treating, maybe for prevention, for managing of symptoms, and any other ailment that the patient could be suffering from. It is through this order that the pharmacy professional provides the medications to the patients, because in a pharmacy we have OTC's medication, those are which don't require a prescription, and the POM or the prescription only medications. I think here should have been POM, the prescription only medication, the prescription only medications to patients. However, if they're dispensing OTCs later on in my discussions, I will discuss the difference between OTC and the POM medication. I shall be going, because remember, in our channel the goal is to share pharmacy information. So a prescription is an important order that demonstrates the relationship between a physician, the patients, and the pharmacy professionals, and the nurse who usually administers the medication. Those are for IV, IM, and any other medication. It's just an order. It's just a continued repetition of the same thing. An order for preparation or administration of medication to patients. So there are two types of prescriptions. We have the pre-compounded and compounded. Now, the word compounding means prepared. So it means that I have pre-prepared medication and also those which require to be prepared. Now, in most of the drugs that we shall be dispensing in the pharmacies, they will already be prepared by pharmaceutical industry. So prescriptions that require you to just issue those medications will be called pre-compounded medication. However, in long time ago, and in some cases today, some medications require to be prepared by pharmacy professionals before being issued, meaning that these ones are not there in the shelves. You have to first go in the lab and then prepare them. However, these ones are not common nowadays. These prescriptions of compounded or extemporaneous preparations. However, in some settings like eye care and any other uh, dermatological centers, some medications could be prepared before being issued to patients. Now, who can prescribe? Because they are basically the physicians, the doctors, and specialized physicians, the gynecologists, all those other pediatricians mentioned by a few, and the physician assistants, dentists, these ones we know them, specialized physicians, this is a repetition, specialized pharmacists, or the because as pharmacy professionals we are not allowed to prescribe, write a prescription, but those specialized ones could be allowed to specialize. The veterinarians for the animal patients. Now, the prescriptions which we receive at the dispensary are basically in different forms. They could be handwritten and hand signed on paper, printed on paper and hand signed by the physician, prescriber's handwriting. In the other centers, we have the medication charts. In the art clinic, some charts are used. Just look at the chart and the age group, just dispense the medications to the patient. Others can be given directed face to face. However, these ones are difficult to store by phone, by fax, by email, or these are electronic prescriptions. All these ones could be issued to patient. However, we have realized a trend in some centers, even government facilities, where some prescriptions are now electronic. It's a system. A patient just comes on the counter, and you already know the medications you would issue to the patient. Just system generated. Parts of the prescription. The prescription has basically 6 parts: preliminary information, superscription, inscription, subscription, signal, and the prescribers. Information, so you could have refill information for those ones which are used in each. Now, what does each one contain? Preliminary information is key. It has the date of when the prescription was issued, the demographics of the patients, the name, the age, the gender, the weight, the address. All these ones are important in identification of the patient. And also, as we shall see in my next presentation, as most of these ones are also important in determining the dosage of the drug to be administered to the patient. The diagnosis is important because without knowing the diagnosis, what are you issuing the medication for? This one, name and the facility, name and also the facility. This one is always on the head of the paper. Now, the superscription or the RX, this one means take thou, or you take the following. The inscription, this is almost the main part of the prescription because it contains the name of the product, the dosage form, the strength, the amount to be dispensed, the dosage, the direction of use, all this one, then the frequency of addition within the day and the time. Subscription, to contain the prescriber's directions, the pharmacy profession. So this one is not common to today's prescription. And the signal, these are directions to the patients. Most of these ones are given verbally. So the inscription is key. Prescriber information, the name, the address, even others could give you the phone number. That's important. And refill information, if the prescriptions are for refill or are supposed to be reused, because some prescriptions can be reused over and over, especially for chronic conditions. However, in others, they are supposed to be dispensed that time and not reused. That's why I always tick amount of medication given. So this is a prescription, a simple one. This is the address of the facility, the date, these are the demographics. The age is important, as we shall see, as we shall be proceeding. Diagnosis, because this diagnosis, as a pharmacy professional, you have to link it to the medication. The medications. This is the RX is the superscription or recipe, and the inscription is the main part. Refill, if it's there, then the address over there. So this is a prescription. However, you'll be receiving many different forms and have to dispense them. However, for the completeness of any prescription, at least should have the following information: the name of the facility, the patient's details or the demographics, the disease condition, the inscription, the name of the product, dosage form, strength, the amount to be dispensed, all these, and the physician's detail. At least if a prescription has these, it is considered a complete prescription. So this has been a short presentation, and part 2 of this presentation is about the abbreviations and the interpretation of these abbreviations. So there are quizzes in our Google Classroom app which have been put there. So always try to attempt them as you'll be given answers directly, and this will help us to try to revise and then see if I've completely understood the information. So